Hi, everyone. Welcome to another one of our Fall Beauty Expo 2021 webinars. And I am beyond excited to talk to you today about some dynamic duos. And let me get my presentation rolling real quick so I can introduce you to a dynamic duo that you hopefully already know. Let's see here. Let's see, can you see my presentation? Are we good?
Yes. We're good.
Awesome. So we're going to be talking about dynamic duos today. One of my favorite things that we're talking about at the Beauty Expo is how you can partner procedures to enhance your benefits. And I think that you'll learn a lot today. I know that I did. But hopefully the first thing that you'll learn is our amazing host today, Dr. Kristy Charles, who practices at the Uptown, Old Metairie, and Pool Dermatology locations in the Louisiana area. And then also our wonderful PA, Alicia Haslaier, who practices at Pool Dermatology. So thank you guys so much for joining me today.
You're welcome.
Awesome. So what we're going to do to get it kicked off is we're going to talk about something that I'm sure a lot of people are curious about, are those dynamic lines and wrinkles. So Alicia, can you tell us a little bit more about those?
Sure. So dynamic lines are going to be the lines that we make just from our daily facial expressions, for the lines when we make repetitive muscle movements that get etched in on our skin over time.
I love that. I love that. So that's going to be those things when you get really expressive like I do, get those little etched in lines. And so when we talk about those types of things, we want to know, what can we do to fix them?
Yes, so what we can do is place something called a neuromodulator. And the most common examples that we use here in the office are Botox or Dysport. And we place that where we're in the muscle groups where we're used to seeing these etched in lines. And so some of the common areas are going to be between the eyebrows. We call that the glabella region. And that's where you might see these 11 lines that people often come in complaining about. Across the forehead, if we have these horizontal forehead lines, that's from a muscle called our frontalis. When that repetitively moves through our just daily expressions, we'll get etched in lines there. Sometimes in the crow's feet, when we smile big and our eyes get squinty, over time we can have etched in lines there. And sometimes bunny lines on the sides of the nose too. We can place the products other places as well, but those are just kind of the more common areas that people come in concerned about.
Yeah, for sure. And I feel like it's a super approachable procedure, something that I feel like a lot of people really enjoy. I know that I very much look forward to my next treatment. So very exciting that we have this as an option to treat. So you were telling us a little bit about some of the areas that you can treat, but if you could kind of point it out here, I'm sure it's pretty obvious, but
sure.
Have an example.
Sure. So the way that it works is the neuromodulator gets placed right into the muscle and it inactivates it so that it's no longer able to contract and make that repetitive movement, and therefore the skin over time won't have that etched in line. If you look at the first picture at the top, that patient is actively raising their eyebrows, causing that frontalis to contract and creating those horizontal forehead lines. But if you look at the bottom picture right under that, once the neuromodulator is in and has had time to settle, usually around 2 weeks, you can see that the skin on top is no longer able to crease and fold when they try to make the same expression. If you look at the skin, the picture at the top middle, that's when that patient before treatment, they're not actively raising their eyebrows, but even at rest, you can see some of those etched in lines. But again, in that middle bottom picture after treatment, it's nice and smooth and you've reduced a lot of those fine lines and wrinkles. And if you look at the picture to the right at the top, that patient is actively scowling, kind of pushing those eyebrows together, creating those 11s. And again, if you compare it to the picture underneath that, after treatment, you're no longer able to make those lines.
That's crazy. Those results are fantastic. I love to see that just such a simple treatment is able to make such a huge impact into the way that the skin looks. Yeah. Let's see here. So one of the things that we're going to talk about as well is skincare. So can you tell us a little bit more about kind of what foundational skincare is and like ways that you can enhance your typical skincare routine?
Yes. So it's really important to have a good daily skincare routine just to keep the skin looking youthful and rejuvenated. And the most important step by far for a good skincare routine, something everyone should be doing, is a daily sunscreen. Just protecting against the damaging effects of the UV rays from the sun. So sunscreen every single day. I tell my patients minimum SPF 30 on a daily basis is a must. Another really important key factor here in a good skincare regimen is the use of retinoids. Retinoids are going to increase your rate of skin cell turnover. They are going to increase your production of collagen, reduce the appearance of fine lines and wrinkles, and keep everything looking fresh. And so that's, the next most important right after your sunscreen. Other things you might hear people talk about is antioxidants, things like vitamin C, and there's lots of our products that we carry here that have different amounts of antioxidants in them. That's going to help fight the free radicals of the sun, so not only damage from the sun and UV rays, but also just environmental damaging like pollution and things that we come across in our daily lives, that the antioxidants will help fight the damaging effects of our skin from those issues too. Using glycolic acids and retinoids can help support and help our skin make some more collagen, so that can be important. And we have a lot of, patient-specific products. Like if someone's really concerned about pigment, we'll have some lightening creams, both bleaching and non-bleaching agents that can help lighten the skin. So that's when a consultation is really important, so we can tailor and make a specific skincare regimen for each person, because it varies.
Yeah, for sure. And I think that's one of the biggest things that we always talk about, is making sure that you're going and reaching out to your skincare provider, whether that be a PA, an MD, an esthetician, someone who can help you select the best treatments and the best skincare for your specific conditions and your skincare goals. So I love that so much. So here is another example that we talked about of Botox. So this is kind of like the before and after of that. And tell us a little bit how something like skincare might be able to pair well with a neuromodulator.
Yes. So just as much as the skincare is important, and we already saw the pictures of what the neuromodulators can do, you'll get the best cosmetic results if you can couple, have a good skincare regimen and also get the effects of the neuromodulator. So if you can see in the top picture, again, you can see the lateral forehead lines with the contraction of that frontalis muscle. And again, even at rest before those procedures, you can have in the little etched in lines. The neuromodulator will stop the muscle from being able to contract and smooth the skin, but then the good skincare regimen can help with some of the finer lines and wrinkles that might still exist if you didn't have them in place, if you only did the neuromodulator. So you will get the best texture and tone, and keep the skin looking youthful from your skincare regimen, but also target the lines in motion from your neuromodulator. And so that top row is just a picture of the forehead being treated, and then the bottom row is just another example of the crow's feet. You can see if you put the neuromodulator around the lateral part of that eye, then when the patient smiles, they're no longer able to make those deep creases.
I love that. That's a really good before and after. So here's just another one.
Just another example of those 11 lines right there. The patient actively contracting those corrugator muscles, and then with the neuromodulator in place, they're not able to make those 11s. And then with a good skincare regimen, we can keep the skin looking fresh and smooth and rejuvenated.
Love that. And then that's just another angle of the same patient.
Yeah.
Let's see here. So now I'm going to toss it over to Dr. Kristy Charles, who's going to tell us a little bit about some other procedures that we can use to potentially pair to get those dynamic results that we're looking for.
Thank you. So I'm going to first go into learning more about filler. And by doing that, it's important to kind of go back and learn the difference between a younger face and an older face, and what happens to our face as we age. So as you can see, to the left is a 26-year-old daughter, and to the right is a 64-year-old mother. And you can kind of see the gradual transition of kind of how our faces change with time. And if you go to the next slide, it's kind of a better diagram kind of showing the inverted triangle that happens. So as a younger patient, you're going to have a lot of volume that's kind of up in the cheeks. You're going to be fuller there. You're going to have less aging of the lower face. That's kind of how we look as we're younger. And as we become less young, we start to lose volume in our cheeks, and it kind of leads to a longer face. Where you start to notice the skin folding around the nasolabial folds, which are the lines from the nose kind of around the mouth, and then below the mouth, which are marionettes. So it's kind of, you can see this triangle change from having volume up here to kind of volume loss with kind of more sagging down low. And that's where volume can be replaced with fillers in a very kind of nice, natural way. Fillers, the main filler that we use is consisted of hyaluronic acid. The two types are kind of the Restylane products and the Juvederm products. And they're very similar, and some patients find that they like one better than the other, so we carry both. Hyaluronic acid is great because it's a natural substance that we have in our skin. It is something that provides natural volume, and the greatest part of filler is we're kind of adding that volume with the hyaluronic acid, which is natural, but the actual movement of the filler under the skin is going to promote your own natural collagen and elastic tissue forming, kind of making that natural appearance. Where to put it, that's where a consultation is really important, because every face is different. We kind of look at you, we find out what bothers you about your face, and then we kind of let you know where we think we could put filler in a very natural way to make you look more youthful.
Love that, love that. So let's take a look at some photos and see where someone might place those and what those results might look like.
So this is a nice example. You can see kind of like a before and after. This is a woman in her 60s. You can see the volume loss under the eyes. You can see a little bit of puckering there, and you can see she has, her lips are kind of turned down in a frown. So you can see volume loss in the nasolabial folds and the marionettes. Usually with a patient like this, we'll actually start with filler in the cheeks, because really replacing that volume loss in the cheeks pulls everything up. And it's so important to see that we're not going to make you too full. In a whole syringe of filler, I mean, I think it's equivalent to 1 teaspoon. It's not a lot, but it's enough to kind of give you that volume, stimulate your own tissue to form and kind of give you the volume you've lost in a very natural way. You're never going to overfill you. We go gradually. We start with the cheeks. This woman also had filler around her mouth, where we kind of did it in the nasolabial folds and the marionettes, just to kind of give that area natural volume boost to complement the cheeks.
Yeah, I love that she looks like she's had a little bit more sleep. It's like she looks like herself. She just looks more rested and a little more youthful. And it's not like you would look at her and think like, oh my gosh, you have a new face. It's just like, you did something, but you look really great. I love it.
So this is an example of kind of defining the cheeks. You can kind of see the before and after. She does not look too full, but the one thing I want you to pay attention to is look at how the nasolabial folds and the marionettes naturally come out with only putting filler in the cheeks. This might be a patient who maybe wants to go back and put a little bit more filler around the mouth, but she might not even need it with the cheek filler. We kind of let it settle in and we reassess, and it's just so important to kind of get that volume back where we really first lost it when we start to become less young.
Yeah, I love it. I love it. And I love how this can pair with something like skincare, which Alicia very nicely told us about how you can pair the different products to make sure that not only are you restoring that volume and kind of helping with like the scaffolding of the face, but then you're also taking care of the exterior of the face by ensuring that your skin doesn't have like your sunspots, or making sure that your skin looks even. So it's kind of like addressing it internally and externally, which is awesome.
Exactly. So lips are one of my favorite areas to treat. I've treated younger lips to kind of give them that big volume that they want. And I've also treated less young lips where we're just trying to get the volume that you've lost. We want to get rid of that crepey skin. We want to get rid of the vertical lip lines. It's such a nice area to treat because one syringe goes a long way at making a huge difference. And it's very natural. It's awesome to kind of pair with the other products that Alicia had done a nice job discussing with the kind of Retin-A, and sometimes even procedures all around the mouth, like microneedling, which I'll get into a little bit later. But filler is a really nice way to the lines at rest and to give your lips volume. This also, Alicia didn't mention the Botox around the mouth. This is a very nice thing to pair with Botox or Dysport one of your neuromodulators around the mouth. They work together because the neuromodulator is going to prevent that pursed kind of tightening of the lips, so you can't make the deep lines, and then the filler is going to fill in the lines that you have at rest.
I love that. I love how hydrated her lips look. They look so supple.
So this is a really up and coming area of filler, the chin and the jawline. So in this patient, she just had a chin augmentation, which a lot of people call this a liquid chin implant. It's a very natural way to contour the side profile of a face that kind of really just brings the light on your face where it should, as opposed to it kind of being down here, kind of pulls the light back on the cheeks when light's shining on you. It's a very nice way to change the entire profile just by putting a syringe in the chin. And a similar thing would be the jawline. We'll kind of work along the jawline and kind of make that nice shaped jawline, which also when you're putting filler there, it's going to lift up what's kind of sagging down low.
I love hearing all these different places that you're able to do that and how you're able to address all these different things and how it targets different stuff than even just where you're placing it. It's really interesting.
So next we'll talk about texture and tone. So a lot of this has to do with kind of like lines at rest, acne scarring, and how we can improve those. So microneedling, I had mentioned it before, it's a really nice treatment for acne scars and for lines at rest. It's great. It's minimal downtime. People usually get it done on like a Friday, and by Monday they're back at work. Over the weekend they can do things. They just maybe have a little brush burn areas or a little bit of almost like a subtle sunburn. It's really nice. Nice procedure that really works great at stimulating your own collagen and elastic tissue to fill in acne scars. So you can see the before and after. Microneedling is great for that. Same thing with around the mouth. If you weren't interested in filler or Botox, microneedling is a nice natural way where we're only using your own body to fill in the areas that have volume loss. Microneedling does require a series of treatments. Usually we do 3 to 4 spaced monthly, and your results you get as soon as a couple weeks, but they can kind of take up to 6 months to really transform the way you're going to look. Another, a little bit more aggressive, but also a little bit more effective treatment is lasering. So there's Fraxel, which is a non-ablative laser, and then there's a CO2 ablative laser. And as you go more up, it's a little bit more aggressive of a treatment, a little bit deeper of a treatment, but it's a safe way to, again, use your own body's healing properties to kind of get the results you want. Downtime for them, both aren't terrible. The CO2 that's ablative is a little bit more downtime, which we'll talk to you in person about if you're interested in it, where the Fraxel, which is non-ablative, is more like microneedling, red, puffiness. Those latter two are really nice because they also not only do fine lines, scarring, but they're going to work on the pigment as well, which is great. The discoloration, skin texture, skin tone. So all in all 3 procedures are excellent. It's just kind of finding which one works best for you and kind of staying within your budget.
I love that. I love that there's kind of like a range of options and different ways to kind of treat the same concept. And then I also know that, like we talked about, meeting with your preferred provider is a way that you can kind of custom create your own treatment plan, because even partnering these types of procedures can help you enhance the results of what you're looking to achieve, which is awesome. I love that so much. So tell us a little bit more about the pigment aspects. We talked a little bit more about the texture of the skin, but one thing I think a lot of people think, especially in the South, is about pigment in the skin.
So there are many ways to kind of target pigment. Alicia did a great job of mentioning products, and no matter what we do in office, the products are so important to pre-treat, post-treat, after procedures. The 2 that I had mentioned just on the last slide, the kind of lasers that work for full face treatment, I think of them as like the non-ablative and the ablative. The non-ablative is for those who can't take time off. They really need more of just a little bit of swelling, and they need to be able to go to work in a few days. CO2 is a little bit more downtime, but you get more with each treatment. Those are nice because they're going to do full facial treatments, you know, fine lines, discoloration, skin tone, skin texture, scarring. It's a really great full face treatment that really can take years off your skin. You can kind of see the before and after just kind of with different procedures to kind of get that discoloration off. And it's kind of depends on, everything's really patient dependent. That's why the consultation is so important, because what you might think would work great for your skin, there might be something actually better for you, or even maybe more affordable that you haven't even thought about that'll work just as well. So that's why it'd be great to kind of meet with people and kind of get to know what they're looking for, what their budget is, how they want to do it, and then what kind of downtime, and kind of set up the plan for them.
Yeah, I love that in these before and after photos, especially the one on the right, you can see how the pigment almost kind of like ages her, which is interesting because her face texture doesn't look aggressively different in the left to right photo, but just the pigment alone, removing that just like took years off of her face, which is really cool. It's awesome to see that there's like so many options for this.
And even that picture, that one that you were impressed with, you can sometimes get that even with a good skincare regimen. I mean, you might not even need a procedure. So some people will start with skincare regimen, like what Alicia had said, with the vitamin C, the sunscreen, the retinoic acid or tretinoin at night, moisturizers, and you can really get a lot from just that. And then we can do procedures to kind of complement that.
Love that. Love that. So tell me about chemical peels. I'm intrigued.
So another way to kind of just get that pigment off are chemical peels. And we, just like all our other procedures, we kind of have multiple options based on how quick you want to see the turnaround, how much downtime you can do, what kind of natural skin color you have. There are certain, darker skin patient can't necessarily do the same chemical peel that a lighter skin patient is, because we have to really take into account their natural pigment, make sure we don't cause any discoloration. We offer a series of peels, one of which is glycolic, which is nice for, skin tone and a kind of discoloration. Then you can kind of go up in strength. Jesner's is nice. It's good for all skin types. It's good for discoloration, fine lines, skin tone. The TCA is our deepest, a little bit more aggressive. It can be a little bit more peeling afterwards, but you get more of a response. And there also is a salicylic acid peel that we have that's good for acne prone patients, because it can actually treat their acne and their scars. So chemical peels, again, you want to do it with a good skincare regimen. You want to have that skincare regimen started before you want to do the chemical peel. We'll probably have you take a little bit of time off around the peel. And then you kind of do a series of peels. Everything's kind of working together with your provider to find the best plan to get you your most youthful self, with using, anything that you feel comfortable with and that we feel like you would be a good candidate for.
Love that so much. Well, I just want to thank you so much and reiterate one more time. We've talked about it quite a few times, but we can never say it enough, how important it is to meet with your provider and kind of discuss what your needs are, because you can see a commercial or an ad online or something on YouTube or Instagram and think like, oh, that's exactly what I need. And you don't necessarily have all the tools to be able to decide, well, maybe that's not good because you might have rosacea, or maybe that might not be good for your skin type. So it's super important to be able to go to an expert dermatologist and skincare provider like these two lovely ladies here, who can help you decipher the best treatment plan for your concerns, and keep you looking like a refreshed and beautiful you. So I just wanted to say thank you so much, Dr. Charles and Alicia, for meeting with me today. I think this was super exciting, and I hope you had a good time too.
Thank you.
Thank you.
Thank you so much.